Well, hey guys, hope you're all doing well tonight. It is Monday, June 13th, and this video I'm uploading right now was actually recorded back on April 14th. It's the day that I went in for my first treatment for TMS therapy. The reason for TMS therapy for me was I've gone through outpatient group counseling and one-on-one counseling, but the outpatient stuff I've done like 7 or 8 times in the last 2.5 years. It gives me a mental break and I'm feeling good when I'm there, but that's because I'm around a lot of people and talking about stuff. And it equips me with skills to be able to cope, but there was something more going on. And in my pursuit of saving my life, because I have attempted suicide twice in 14 months, somebody down in my group therapy had said that maybe you could look into this therapy here. So it's 36 treatments spread out over 9 weeks, and I'm down to my final 3. And it took me about 4 weeks, almost 5 weeks, before I actually started to feel like my brain was functioning properly and I could start thinking about things in a proper way, and I'm handling issues, no longer freaking out, no more anxiety attacks. My depression, which I have felt literally since I was 15 years old, and just so you know, I'm 52 now, is literally gone. The issues are still there. This hasn't erased the issues. But what they did is they took this severe depression that I had. They took the anxiety attacks. They're all gone. I had a lot of trauma in my life, and the nightmares that I would have on a continual basis are gone. I haven't had them in, well, it's been 6 weeks, so let's say that. They're gone for the last 6 weeks. So this is just a lousy intro to the video. The video again was recorded on April 14th. It was the very first session going into this therapy. Dr. Dubose, Trisha, Kristen, and I didn't get the other intern's name, and it drives me nuts, but they were all awesome. They were sweet as can be, and it didn't help that they were all cute. Yes, they were cute. Even you, Dr. Dubose, for a guy, you're cute. Anyways, love you all. Thank you so much for watching. Please send this to somebody that you know that's been struggling hard, because it really has turned my life around, and I'm so excited about what my future looks like, because now I feel normal, and it's what I've been pursuing for a very long time and haven't felt before up until now. So have a great night and enjoy the video. Well, hey guys, here I am down at Greenbrook TMS for my first treatment, and right now I'm filling out a boatload of paperwork. So probably another 15-20 minutes, but I'm going to probably record this whole interaction here and see during the process to see how it affects me in good or bad or in different ways. But I appreciate all your love and your support, guys, and I'll talk to you in a little bit.
There you go. Man, beautiful. All right, cool.
We can get this color, this marker.
Yeah, that matches the shirt. All right, Phil, might take your glasses off for me. We'll need to take those off.
They're about to play connected dots on my head.
That's right. How'd you know?
Or if you want,
I'm going to make you look marvelous. I'll make you look marvelous.
Dude, they've been trying to do that for 4 years.
All right, so let me explain what I'm doing, because I also have students. I want to kind of walk you through this process. The first step, we need to figure out where is our target, what's our location. So what we're looking for is called the left prefrontal cortex. It's typically about right here, but we need to be very accurate. The more accurate we are, the better chances you'll get the results that we want. So first thing we're going to do is a series of measurements. I'm going to let the computer do some hard math for us and give us some coordinates of approximately where the location is. And then we'll go to the chair and figure out how much dose did you need.
Oh, you got it.
Yes.
Okay.
She's trained on muscle. So we're going to start here, but just kind of get an idea of your head. We're trying to find the vertex.
More. Call me Norson. Call me Norson. No.
Get a free head massage.
You know, I don't usually say this to guys, but that feels pretty good.
There you go. Yeah. Yeah, I'm not even going to charge you extra. All that.
36. Would that be 18?
18.
Okay. And then.
Divided by 2.
Yeah, 36 divided by 2.
For what it's worth, it's the most I've been touched in 3 years.
Modified Y is
9.96.
9.96.
That's the first time I've ever been a 10 in my life.
There you go. Bam. Hopefully you feel like a 10 when this is all over.
Yes, not today, but in June. Come June.
You look marvelous. Get a close up of these beautiful.
Thank you.
Dots.
All
I
right.
should have shaved a little closer.
All right. So next up, we are done with this part. Go ahead, man. Let's get into the chair here. Position we get you in now is a position you got to stay in the whole treatment. If we have to move your position, we got to start all the way from the beginning.
So,
which is not very convenient.
No, that's fine, because it's only like, what, 15, 20 minutes, something like that?
It's about 15, 20 minutes.
Okay, once we get
At
done,
lowest,
then.
it's going to be 17 minutes.
Mhm.
On average, I'll say 18 minutes, 20 minutes.
I could
With
sit
this
down.
protocol.
I'm gonna tuck your chin in. I still want you to be comfortable with that. Yeah, that's what I have to do if you change this. Yeah.
Can we move this up a little bit? Can I go up?
Yeah. Should I find out like each session?
Just even if it's just me, then I just came on number 2, came on number 3. So I can just sit on the back and
So kind of
I had plans to do it. I used to put them out frequently then. Then I just went for testing.
Alright.
I got a little bit of
So I think that's good. There's a little bit
This is way more comfortable.
of so.
I think
Just a little bit.
we came out with a new version of that camera, by the way, and it's like it overheated like within 4 minutes. Yeah. So they have to come out with a new case. I like that one better because it works a little bit over stuff. Like over there, yeah, over the camera. It's nice that you shouldn't, even when I'm holding on this close, you shouldn't get external cameras so you get that quality.
So
So if you got an old Samsung phone, like AT&T, some carriers are doing like 8 ratings for it. Or for running funny usually. Yeah. And I am smushed as much as I can smoosh.
I'll leave it. Okay, remember that. Okay, back to the piano. Okay. Let's turn the lights off so we can see that laser a little bit.
I keep expecting you to swat me in the forehead when you do your.
Not when they're around.
Hey Trish, are we still giving that copy of this book? Or y'all
Yeah.
them out?
No, you can. I think we have an extra one
Oh,
upstairs.
it's got Mark George in it. So Mark George is like the father of TMS. He's a researcher at USC. So if you have not seen this book,
I can't see it now.
can you see it now? It's called Three
Oh, yeah,
Pulses Later. It's one of the individuals that did TMS documented her experience too, but just in a book form.
Nice.
So a lot of the patients like to read through it as a companion book as they go through the treatment. And if you'd like a copy, Trish can get you a copy of that.
Actually, you can take that one.
You sure?
Yeah, we have one upstairs.
Oh, very cool.
So I did have a question for you.
Yes, sir.
So like I'm on 80 milligrams of Prozac a day. I'm obviously going to maintain that. Is there any point where I can start dropping down on that if I'm feeling any progress?
Here's my recommendation on that. So, my observation has been TMS works best in conjunction with the medicines.
Mm-hmm.
And my personal opinion would be, I wouldn't mess with anything. Like once it's almost like a house of cards.
Right.
When you get to a point where you feel better, don't move nothing. Okay?
Okay.
You want to have a period of stability before you start pulling off your meds.
Right. Or at least dropping down on it.
Right. So usually what I'll tell patients, wait at least 6 months of feeling better. Because when we're supplementing the brain with other neurochemicals, well, the brain adapts to that.
Right.
And when you pull that rug from underneath it, it's got to readapt again, and sometimes that make you crash.
Okay.
So just try to be patient with that. Best case scenario, you're gonna wanna, get off your meds because you feel
That's
better.
the hope, because I hate taking pills. So.
Exactly. But I would say please be patient with that.
All right, will do.
Um,
But we talked to. Okay, cool.
you good on your Trish?
Yeah, you're good. You can see. Everything's saved.
I tell you to go ahead and find my better side, but I really don't think it
Both
is.
sides. Both sides are good.
The good thing is that the mask makes me look like a 10.
All right, so let me give you a couple tips about this before we get started. Number one, first and foremost, try not to nod your head yes, shake your head no, because we kind of lined you up with a laser and we need to reproduce this position. So just be mindful of moving your head. You can still move your arms and things like that, but try to keep your head still the best you can.
Okay.
Just to be thorough, Mr. Jeffrey Betch? That's it?
Yes, I started to shake my head. Son of a bitch.
There you go, son of a bitch.
Betch.
Betch.
Yeah, just get rid of the S and it's Betch.
Son of a bitch. Did the bird.
Yeah.
All right, oh man. All right, so let me explain what we're going to do first. So our first endeavor here is to figure out how much energy is necessary to make your nerve cells fire.
So this is the hitchhikers.
That's right, we're about to do the hitchhiking
Yeah,
thing.
pay attention.
You did. So what we're going to do is I'm going to place the coil over the area of your brain called the motor strip. The motor strip is responsible for your motor movements, or your voluntary movements. So hopefully what'll happen is I'll put some energy in there, and if your nerve cell fire, it's going to make your hand move. Okay?
Okay.
Hopefully it'll be pretty smooth and pretty easy. Kind of cool to see. We can capture it on camera, hopefully. So I'm going to get you set up. So I'll need a few minutes to do this. So same landmarks, girls. We're going to make sure that the coil doesn't cross the midline if I can help it. We're going to hit our anatomical landmarks of the tragus. The coil. And I want my angle of the coil.
Thank you for documenting this, by the way. What's your name?
Kirsten.
Thank you.
Shout out to Kirsten.
Shout out to Kirsten.
Have you given him your hourly rate yet?
Oh, don't tell
That's
him
later.
that. Just send him the invoice.
She does a good enough job. She we might help her.
You can get hand massages too.
Mm-hmm.
King for a day.
And then actually have you stretch out your hand and wiggle your fingers.
All right, so I want to be in the video in a different way.
Okay.
So I want to kind of show what we're looking at. So we're going to do some hand massages and prep his hand to receive
Have you ready that?
a magnetic pulse in a second.
Okay.
And we use these numbers to figure out where the coil is in space so we can reproduce it in the future.
You cracking on my knuckles? It's just an age thing.
And the hand massage helps the muscles be prepared to receive a nerve impulse. So we can keep this low, this dose as low as possible. All right, I'm ready, Trish.
Okay.
So this is called a hitchhiker position.
Mhm.
And you're going to do spirit fingers. Relax.
And then drape it over.
Very good. I'm going to put your hand right in that position there, my friend.
Back, step down, but try to keep it.
And just keep your thumb in that
Yeah.
position. All right, here we go. Pulse. Let's see if we can get some.
I felt the ping on my head.
Yep, it's going to take a little while before you get it.
It's like getting that little mallet smacked on your knee. It's like going on my head right now.
Alright, trash out of this one, just stretch and relaxing. Alright, stretch and relax.
Same thing.
Could banging on my head against the wall my whole life be causing it to be so hard?
Stretch out your fingers again.
You're doing fine.
Alright, perfect. Keep that
My
straight.
bad, Trish. I thought you had let go.
What doesn't want to? Okay, keep that somewhat straight there. Okay,
There
good.
we go. Not yet. That's okay. We're doing good.
Yeah.
Saw it?
That's
I missed
alright.
it. I'm going to do it
I'm gonna,
again. Very subtle.
Yeah.
I want to see a little bit more. Oh, there it is. All right, definitely
Saw that one.
Pause.
Do it
So
again.
we'll stop there.
Alright, you can relax.
Again.
So this is his dose. And it kind of gives us an idea of how much energy is necessary to make his nerve cells fire. So this is kind of a starting point. We're going to try to taper that dose down to a lower dose. The lower the dose for TMS, the more comfortable the treatment is. So I would say his dose is around average in his age group. We want to see if we can get that lower though. Okay. So I did get first this finger. Did you see it still
I
the
did
first
see
time?
it then, yep.
Okay, so we're in the right spot. So this is kind of a different technique than you normally see people do TMS with. We use what's called the beam method, which was the measurements. So we know your location, so we don't have to estimate it.
Right.
All right, Tricia, your numbers. I got a coil angle of positive 10 degrees. I have an AP position of 6.5. I have an SOA of 40 degrees. Yeah, let's call it 40 degrees. And this MT is 1.2 so far.
Okay.
Let's
Okay.
get him ready for the MT assist.
In this, we're going to have your hand kind of drape over this foam block here.
Okay.
And then more hand massages.
Yay.
And it's going to be a series of pulses. So.
Okay.
So the purpose of this next step is to bring your dose down to as low as possible. The higher the energy, the more uncomfortable your actual treatment's going to be. So when woodpecker gets going, the higher the energy, the angrier it is. And it's going to be more uncomfortable. So we're going to try to get that energy down as low as we can. So you're going to get a series of about 30 pulses. They'll be 7 to 10 seconds apart. The machine's going to vary the energy, and it's going to make a recommendation to us, which should be the lowest that will still cause your nerve cells to fire. Okay. All right. So here we go. Here's our first pulse. Anybody sees hand movement, it counts as a yes. Nope.
And have you push on my hand. Keep pushing. A little bit more pressure and relax.
Relax.
Yes.
Yeah, I felt that one.
Make it move.
You like jumped out of my skin almost.
Yes.
Yes.
That's weird.
So there's a brain in there. We got that part. We got that part.
Documented on.
I'm on camera. That's a yes as well.
However, it's still hard to fix stupid.
Yes. Have you press against my hand again? Keep pressing and relax. Yes.
That's good. We're getting some good numbers back. Let's do that again. Hallucinating some motion there.
Have you stirred it for 1 minute? No.
You're doing a great job. Both of you.
She is in the zone.
Yeah, she's helping me.
Supporting her.
And you press against my hand again. Keep pressing. And relax.
That's all.
Pointer.
That's all, yeah.
Oh, that felt like my middle finger kind of moved a little bit.
Bam!
Because that's the one that's usually on it.
No.
Did you find the nerve yet?
I think we were hitting it pretty consistently.
Yes.
Say yes to that. Very mild though. That's all we need. That looks way better. Makes me happy.
Okay, one time, make it just jump right off the chair.
Okay. Oh, wait till we get to the end.
Have you pressed against my hand again? Keep pressing. And relax.
I saw some thumb and
Out
pinky.
there.
I think
Yeah.
it's pinky, yeah.
No.
Have like 2 or 3 more.
And then I'm gonna have the big one to see if I can make it. make them flick us off.
Oh, never mind. This
Oh,
one.
there we go. It
Damn.
works.
Damn.
It works.
All right.
Alright, so we're gonna do, I gotta do one more close so I can save it because it's gonna be the more close, okay? Alright, there we go. So, the machine recommended 1.08. So we'll stick there. So our final numbers are going to be AP of 12, call angle of +10, SOA of 40. And our SMT is 1.08. So now we're going to move to your treatment location. It should be pretty close to that circle we drew earlier.
So the way you've been trying to explain the reason for TMS is basically, seems like the brain is kind of shut down in some areas. Would that be about correct?
Well, you know, I think that's close. That's very, very
Trying
close.
to keep it as
Basic as we
Mhm.
can. So I would say, like, the way I kind of rationalize it is, you know, I think first of all we don't fully understand depression, because otherwise we'd have better overall treatments. The medicines would work better. But the hypothesis is that when people are depressed, there are certain regions of the brain that are under functioning. The nerves aren't firing as much. There's not as much oxygen that the cells are using, not as much sugar the cells should be using. They're just not firing and not talking to each other. So the area that we're stimulating right here at the corner here in your hairline would be, it's called the left prefrontal cortex.
right.
So we know from like head imaging, like we did a PET scan, which would measure the activity of the cells, those cells would be functioning a lot less than a person without depression. And we also know that if we stimulate these cells, it stimulates a circuit in the brain that regulates your mood. So the hope is we're going to force your nerve cells to fire. We're going to do it over and over again, up to 3,000 times in the treatment.
Right.
And it's like taking your nerve cells to the gym. They work out every day. You know, in the beginning, there's no results, right? But we keep doing it over and over again. Eventually, your nerve cells get more fit.
So in other words, I need my ex-wife to take this too.
Maybe, I don't know.
Get fire up her brain.
There we go.
She's gonna watch this, and we're friends. So.
Shout out to the ex. But yeah, so what we're hoping is just doing this continuously will stimulate and activate your nerve cells to do it on their own. Hopefully relieving depression. So you should anticipate improvement around week 4 and 5 or so. If you notice anything before then, most of those patients get to where they want to go.
Right.
So early response is usually a good prognostic factor.
Okay.
But don't freak out if you don't notice anything by the first month, okay? Some patients are late responders. They may go all the way through the treatment, not notice anything, and then after the treatment start seeing some improvement.
You know how hard it is for me not to answer you with a head nod?
It's very hard.
Yes, it is.
All right, blink if you understand. He doesn't understand. You're awesome. All right, so let me explain the next step, what we're going to do. So now we've determined your location that we need to stimulate. We've determined your dose that's going to cause the nerve cells to fire. The last step is make sure you're comfortable. So let me explain what we're about to do. So now I'm at your treatment location. I'm going to make a couple other adjustments with that. But unfortunately, there's always a catch, right? Mm-hmm. There's a nerve that comes out of your skull near the treatment site called the trigeminal nerve. It sits across your face like this. And its job is to supply pain sensation to your face. So if we accidentally hit that nerve, you may feel pain shooting into your forehead, eyebrow, into your eye, nose, jaw, or cheek. Okay? We don't want any of that, even if it's mild. Because what's going to happen is as we increase your dose, that's going to get more and more severe.
Right.
So what I'm going to do is we're going to let it go for what's called a train. So a train is 4 seconds of stimulation followed by 11 seconds of rest, so your nerves have time to recharge and the machine will overheat. So I'm going to let it run for 4 seconds. I'm going to stop it, and we'll have a dialogue about what you felt. Here's what you should feel. Tapping underneath the corner. Woody Woodpecker doing his thing. It's also normal to have like vibrations in your sinuses or muscle twitching. That's all normal. Okay. What's abnormal is that shooting, stabbing, sharp, electric pain or pressure-like pain in your face. Okay, that means I'm on that nerve by accident. If that does happen, you just got to be able to survive for 4 seconds. I'm going to make some adjustments and see if I can get off that nerve. And at that point, it's just moving like a millimeter at a time until we get off of that space so we can stay on your treatment location. Okay. All right, so let me a little bit better. A little better contact there.
I feel like I'm wearing a CPAP mask.
You are? All right. So your total dose is going to be 120% of what we just found, but nobody can manage that the very first treatment. We're going to take you down to about 65% of what your total dose is going to be. We're going to work your way up over the first 5 to 7 treatments or so. Okay?
Okay.
All right. In a moment, I'm going to press start. You'll hear a chime. And then the machine will render 4 seconds. Are you ready? Let's do it. Here's your first train. And pause.
Yep, I could see how the headache will happen.
Mm-hmm. What did you feel? What was
Woody
that?
Woodpecker.
Woody Woodpecker, did you feel anything in your face?
My face always hurts.
Any new pain in your face?
No.
All right, very good. So here's what's going to happen. The machine's going to go up by 1 to 2% for the next 3 or 4 times. It's going to stimulate. It's going to stay the same from there. I'm going to let it run to make sure nothing develops as the energy goes up. If we make it through these first several, then we know we're in the right spot. So we're just going to let it run.
Man, I hope I don't scream like a little girl.
Hey, it's always like the toughest, biggest guys that have the most pain.
No,
It's usually the little ladies that's like, bring it on.
The tough ones.
They're tough. It's us big guys who can't handle it.
Let's check on
You're doing good though.
Yeah, as soon as it stops, it just all relaxes.
So one thing that I usually tell the clients to do I like to have the chime on there so you know it's coming.
Mm-hmm.
When you hear the chime, just take a breath and then blow out for that 4 seconds while it's stimulating, especially as you're getting used to
I'm
it.
actually, yeah, I've been, all right, I'll keep practicing my breathing on
How's your discomfort? Let's say 0 means no sensation at all. 10 is excruciating pain. How
that. Maybe a
uncomfortable?
4.
A 4. Okay. So here's what I anticipate to happen. This is what happens to most people. When you first start feeling this sensation, the pain's going to walk up as we increase the dose. But as your scalp acclimates to it, the pain will plateau out, and then it'll start going down, even though we're still increasing the dose. That's what typically happens. We'll give
Yeah,
you.
it feels like I got just like a short 4-second headache, and then it goes away.
Okay.
But headaches have never really bothered me, so.
So that's a good point. The most common side effect to this is likely headache. That's the most common side effect. Typically, if you do have headaches after treatments, just a Tylenol or something is sufficient to make that go away, or ibuprofen, if that's your over-the-counter that you prefer. I would encourage you, while you're here, to do a few things. One, make sure you engage with the treater. All right? So if you think about it, most time people are depressed, they just want to beat themselves. You mentioned that. Hey, this is the most people have been around in a long time. Well, take advantage of this opportunity and engage with people while you're here. We'll be happy to talk to you.
Yeah, but you don't stop.
Okay. Cut. No, I was kidding. Here's number 2. I tell all the patients do this only if you do it, but I really think it enhances your treatment. There's a beautiful rose garden right across the street on the governor's mansion.
Mm-hmm.
I always encourage people, after your treatment, go over there, walk in the gardens, walk around the fountains, maybe do that for 15 to 20 minutes. One, because exercise has been linked to improvement in depression symptoms.
Right.
We know, a nice study that was done at Duke, all they did was 30-minute walks 3 times a week, and compared that to patients who were on a new antidepressant. And they had just as much antidepressant effect. So exercise is equivalent to being on one antidepressant. So use this opportunity, since you got to come out anyway, to start walking. Okay?
Mm-hmm.
I think that'll help the process. And that's something else you have control over, that you can,
Right.
take advantage of right now. And finally, my last tip I'd like to put on people when I have them strapped in the chair, they have no choice but to listen to me, is pay attention to your nutrition. The more sugar you eat, the more problematic things get for your brain. Okay? Sugar is pro-inflammatory.
Mm-hmm.
It increases inflammation in the body, and the brain does not like inflammation. It sees it as a threat.
Okay.
And it kind of goes into that depression, anxiety mode. Okay? There's a whole branch of psychiatry called nutritional psychiatry that's budding now. And we know from a lot of the research, it's sugar that's driving a lot of our, 20th century or 21st century diseases.
Right.
Okay? So just be mindful. If stuff has added sugar, you probably shouldn't eat it. Sugary drinks, gotta cut back on that, my brother.
Just got my coffee. No, I don't drink salt.
Good.
And I'm doing decaffeinated tea for a while, or not decaffeinated.
Unsweet.
Unsweet.
Good. Very good. So watch out for those things. There's also a lot of hidden sugar in food.
You're not getting my coffee though.
Well, you can have your coffee. You can have your coffee.
I do get sugar free.
Yeah, just be mindful. Just be mindful of your sugar.
Right.
So I've learned if you go cold turkey, most people can't stick to that. Just look for some common sense ways that you can reduce your sugar. So watching what you drink, that's an easy one. Paying attention to labels. So if you see something that has more than 10 grams of added sugar to it, you probably shouldn't eat it. So just be mindful of that and look for some opportunities to lessen your sugar intake. Okay. So far we got exercise a little bit.
Actually, like ready to fall asleep.
Really? See, good. Very good. So you're getting used to it.
Mm-hmm.
So, number 1 would be start exercising a little bit. Number 2, watch your sugar. Number 3, in my opinion, this might be the most important. Watch what goes into your brain. Watch what goes into your mind. Watch what goes into your heart. So guard the gates of your mind. What that means is, don't put nothing else negative in your mind. I feel like watching a bunch of news and fretting over everything that's going on in the world is not helpful for you right now. Social media and comparing your life to everybody else's life, that's not really helpful for you either. So I've learned the only way you get good at something is by studying and practicing. Okay. So read things that may be helpful for you when you're going through this. Go on YouTube, listen to motivational speakers. Listen to pastors preach about anxiety and depression. Just put as much ammunition that you can into your mind, so as these bad thoughts come up, you got something to fight them with.
Right.
Okay? Become intentional about that, my friend. Okay?
Right.
Now I'm going to ask you, if I see you, I'm going to say, how many minutes of YouTube you watch to help yourself with depression? I want to see it.
Yeah, I'll show them
It's pretty blue.
Yes. I look wonderful right now. Oh, I look like a star.
got Woody up here. I'm going to call this Woody from here on out.
Yeah, he only gets louder.
He only gets louder?
He only gets louder.
Great. So, well, once again, Trisha. So Trisha's cool with me doing this. She's awesome. And the whole staff is here is awesome. This really does feel like someone's hitting me with like the little hammer on the knee thing, but doing it really quick. So, doesn't hurt though. It's a little annoying like right now, but then I know it's going to stop. And I'm good. So we'll talk to you later. I'll talk to you after I'm done. So did I do good?
You did great.
I survived.
Not quite up to full power, but we'll get there probably by the end of next week.
Really?
The latest.
Okay.
I want to try to get you there by Wednesday, though, because that will be your 5th treatment.
Okay.
That's the goal.
All right, so I'm here. Well, wait, hold on. So thank you, my dear. Appreciate you.